my name is Lacey Tamboli and I'm a senior dental hygiene student at Concord Career College. I'm going to be presenting my table clinic presentation today. My table clinic presentation topic is on oral piercings. I chose to do this topic because before I did the research to complete this project, I was not educated on how oral piercings can negatively affect patients' oral cavity. Now that I have completed this project, I feel that I'm educated enough to treat patients who have oral piercings and be able to educate them on how these piercings could negatively affect their oral health and oral hygiene practices in the future. So, the first thing that I want to talk about is what is an oral piercing. So, an oral piercing is the cosmetic piercing of the oral cavity for the insertion of rings, studs, or pins. Oral piercings can come in all shapes and sizes, and as dental professionals, we need to be able to recognize all the different types of piercings and what complications they can cause when treating our patients. Because if we are not, patients may come to us with questions and we need to be able to answer them properly and educate them on how these can affect their oral health. So let's discuss some of the types of oral piercings. There is the standard tongue piercing, which is the most commonly seen oral piercing among patients. There is the beneath the tongue piercing, also known as the tongue web piercing. There is the uvula piercing. There is the lower gum tissue piercing, and there is the upper frenulum piercing. Along with the upper frenulum, patients can also get their lower frenulum pierced as well. What should we do when we treat a patient who has an oral piercing? So as dental professionals, we do need to be able to educate our patients on how these oral piercings can affect their oral cavity. So when we are treating patients who have them, you must examine all parameters of the piercing to look for any signs of infection or an infection already taking place at the piercing site. Once this is done, depending on whether the patient does or does not have any complications with the piercing, we need to explain the condition of the piercing and also how the piercing could negatively affect the patient in the future. When we treat a patient who is considering getting a piercing and they express that to us for our education on them, we need to explain the common complications we see among oral piercings and how it can negatively affect them. And obviously it is up to them whether they choose to go through with the piercing or not. So, let's talk about some common oral complications. As we know, the oral cavity is home to numerous microflora and bacteria and is a constant moist environment that has a rapid cell turnover. Due to this, the oral cavity provides the ideal place for infection to grow and flourish. When the normal functions of the oral cavity are disrupted by the insertion of foreign objects, such as oral piercings, many complications can arise from this action. For instance, it can easily cause infection, as we discussed, trouble with speaking and swallowing, commonly seen with the uvula piercing, and if the infection is not treated properly, it can eventually spread to more severe infections and complications such as hepatitis and endocarditis. Therefore, when we see any sign of infection, we need to warn the patient immediately that they have this infection and they need to contact whatever tattoo parlor or piercing site that they got this piercing done and provide better aftercare instructions on how to care for this piercing properly. Another aspect of complications that are relative to dentistry is the possibility of permanent nerve damage and calculus buildup around the ring of the piercing. Due to this, if the nerve is permanently damaged, it can cause complete loss of taste. As far as calculus buildup on the piercing, this will need to be removed so further infection does not have the opportunity to spread. In addition, calculus accumulation on the jewelry will result in poor oral health because the patient does not obtain the proper instruments they need to effectively remove this calculus. Now I want to explain some of the pictures I have added on my presentation. This first picture down here is infection at the piercing site. This picture shows a patient who had a standard tongue piercing and obviously did not care for the piercing properly. An infection started to spread, and eventually the patient was forced to remove the piercing because the infection had spread so far. The next picture is a picture of the lower lip pierced, and due to this it has caused a malocclusion, and the patient is now experiencing tooth abrasion across their incisal edges of the maxillary anteriors. Due to this malocclusion, we know that this can cause some mobility due to the repeated action of the malocclused bite, and if the mobility is not taken care of, it can eventually cause tooth loss due to the loss of bone from the mobility. The last picture I have over here is a picture of gingival recession on the facial surfaces of the mandibular anteriors, and this is due to the lower frenulum being pierced. This is because the pressure of the piercing is pulling that frenulum down and putting constant pressure on that tissue, and eventually the tissue will be pulled away from the teeth, exposing more root surface. So the last thing I want to leave with is this picture I added, which says, "Don't put a hole in your oral health." Us as dental professionals need to be highly educated on the negative effects of oral piercings and be constantly aware of patients who have them and be able to educate them properly. This is my presentation on oral piercings, and I thank you so much for watching.